Ladies and gentlemen, I regret that I cannot be with you today in Sofia, but I'm pleased to address you in this way. The selection of the topic for the Eurochild 9th Annual Conference and the preceding events on family group conferences and foster care is very timely. The deinstitutionalization of children is especially significant in the current climate. We are all aware of the sad fact that around 1 million children live in alternative care across Europe. We are also aware of the evolution in approaches where institutions were initially considered the right tool to care about vulnerable children. By now, it has become clear that community-based care can provide better results for children, their families, and the community itself. In these times of budget constraints, we also need to look at the economic side. Here, we are reassured by the evidence showing that the costs of community-based care are comparable with those of institutional care. The current economic and financial crisis should therefore not be used as a pretext to delay existing or planned processes of transition from institutional care to community-based services. I know DI has continuously been high on the agenda in this country over the past period. A recent UNICEF report acknowledges the efforts made to reduce the number of children in residential care institutions. This number dropped by over 40% in 10-year time, 3,000 children per year. This experience should be shared with those who design and implement quality family and community-based alternatives. I therefore congratulate the Eurochild and the National Network for Children for having organized this conference. Ladies and gentlemen, the prosperity of Europe's aging societies depends crucially on its capacity to give its children the best start in life. More than a decade of cooperation at EU level has led to a common understanding of the determinants of child poverty and contributed to a consensus on the policies that work best. Yet, with children and their families are being deeply affected by the current economic and financial crisis, more and quicker action is needed. Investment in children and support to their families, regardless of their background, is one of the most fair and efficient investments. It will not only enhance children's well-being and right to a life in dignity, but also help our societies prepare for a better long-term future. This is particularly true when it comes to children in alternative care, from whom we should make additional efforts. Caring for Europe's children is a shared responsibility, where we all have a role to play. While parents remain at the forefront as children's primary carers, public authorities and civil society are essential actors to support families and help them in their parenting role. We know that in some cases the parental role is taken over from the parents themselves, but this should be a solution of last resort. A preventive approach which tries to keep children in family environment is always to be preferred. If, however, this is not possible in the child's best interest, then it is essential that children are placed in a supportive environment. Challenges to improve the quality of existing residential facilities towards family-friendly services and to foster individualized support for the transition into and out of alternative care need more coordinated support in the areas of education, employment, housing, legal services, health, and social assistance. Overall, these policies are primarily the competence of the Member States. The European Union has an important role to play in supporting and complementing their efforts in terms of financial support and policy guidance. First, a number of EU financial instruments are currently supporting actions to prevent the need of institutional care and prepare a smooth transition to independent living for care leavers. For instance, the Progress programme has recently financed a social policy experimentation project in Italy, Bulgaria and Romania to better support young people when leaving institutional care. The European Social Fund supports a Bulgarian foundation for our children to recruit more foster parents to move children from residential home to a family environment. I believe EU financial instruments have been a good lever for action across the EU, with many positive outcomes. However, more needs to be done to support Member States make better use of them to reform their care system. The Commission is therefore collaborating with the European Expert Group on transition from institutional to community-based care in the preparation of guidelines on deinstitutionalization reforms in Member States and will support their dissemination. The next multi-annual financial framework should also be an opportunity to strengthen our action. The Commission's proposals have identified early childhood education and care and the transition to quality alternative care as priorities. An equal commitment is now necessary on behalf of the Member States, which I hope will support our proposal of allocating at least 25% of cohesion policy resources to the European Social Fund and at least 20% of this amount to social inclusion. But funding alone is not enough. The EU also has an important role to play when it comes to strengthening policy coordination. The Europe 2020 strategy has clearly highlighted that supporting Europe's next generations is essential for Europe's recovery, and this should be reflected in Member States' key policies. In July, a number of country-specific recommendations therefore called on Member States to step up their efforts in fighting child poverty, adequate income support measures, quality childcare, or social services for children. We will now work with the Member States to monitor progress. The Commission will report on progress in these areas in the first half of 2013, when it comes forward with renewed draft recommendations. We also very much welcome the efforts of the Cyprus Presidency to address child poverty at ministerial level. This has led to the adoption of Council conclusions on tackling and preventing child poverty, promoting child well-being earlier this month. Ladies and gentlemen, building on the consensus built over the last month, the Commission will soon adopt a recommendation on child poverty, which will propose common principles as well as clear monitoring instruments. The recommendation will support the EU and Member States' efforts to develop better policies, and more importantly, it will send a clear signal that investing in children and families is essential for Europe's future. I am looking forward to further working with you in this direction and wish you a fruitful conference.